Welcome back. I'm Dr. Jim Collins, and I've got a sad topic to discuss today. I've been looking into it with this COVID-19 outbreak. I've been looking at a lot of topics: depression, anxiety, mental health in general, how to protect oneself. And I've come across some literature that I previously did not think about. But I'm digging into it more and more and more, and it's sad, and it's something that we do have to do something about. We have to pay attention to this. So my topic today is lockdown, drug use, and suicide. Many experts are very concerned right now about the new social conditions brought on by the novel coronavirus, namely drug users or those in recovery being in lockdown, and the potential for suicidal thoughts or suicidal actions. The media, if you're paying attention, is already reporting that suicides are increasing around the world and here in the United States. And some are related to substance use, mental health issues, or both. The additional stressors that are being linked to an increase in suicides involve a down economy and unemployment. Those things greatly matter when it comes to substance abuse and suicide. Let's look at unemployment and substance abuse. There is a strong relationship that exists between unemployment and substance use, and it's been throughout the literature for decades. The Department of Health and Human Services found the rate of drug use is twice as high for people who are unemployed. Alcohol abuse is also much worse during times of high unemployment, like right now due to COVID-19. This raises questions about the use of ERs, emergency services, and potentially a lack of emergency care. The National Bureau of Economic Research found that, quote, each percentage point in county unemployment rates produce a 3.6% increase in opioid deaths and a 7% increase in emergency room treatment for opioid overdoses, end of quote. Those are terrible numbers. Increased visits to ERs around the country is worrisome for many reasons, but considering the already stretched medical system that we have, scrambling for resources like PPEs, and increased risk of spreading the virus when people come into contact in emergency rooms across the country. And if emergency medical care is not available, it's possible that more people are going to die during this outbreak. This is grim. I understand it. It's really grim information. Mental health matters. The connection between increased substance use and suicide in times of recession is that unemployment creates more anxiety, it worsens depressive symptoms, and it diminishes people's quality of living. It's possible that for some people, less money in their pockets could actually lead to fewer drugs or alcohol being purchased and used. On the other hand, though, there will be people who will seek out cheaper and more dangerous alternatives to feed their habit. They'll try things they never tried. And if things are cheaper, i.e. heroin, that might be the next drug of choice. Pre-existing health conditions matter as well. Physical health suffers as well as mental health during economic turndowns, and partially due to the increased use of substances and alcohol. The use of drugs or alcohol can exacerbate or worsen pre-existing health conditions like cardiovascular disease, lung disease, diabetes, and so on. So here are some lessons learned from the 2008 recession. It seems like a long time ago now, 2008. There has been a well-established link between high unemployment and suicide. This relationship is exacerbated by the use of substances during bad times in the economy. Experts have found that suicide rates tend to spike early during recessions. So that's when interventions are most important. That's when recognizing, reaching out, and helping people right at the tip of the tidal wave. That's when we need to keep our eyes open, listen to our friends, and reach out to people. So the spike comes early during the recession, as well as use. So we are looking at 2008 as an example. During this recession, there were 10,000 suicides related to the economy throughout the Western world. So we're talking about the United States, Canada, Western Europe. Of those 10,000 suicides, almost 5,000 were here in the United States. I don't know if too many people know how many suicides were related with the economic fallout of 2008, but there you have it. So coronavirus is creating a frightening and looming mental health crisis now and for some time to come. It will be difficult to track the numbers of death by suicide than those due to the virus. Although what's happening right now, and I just heard it yesterday, cause of death is really confusing. Some people may have COVID-19, but they actually died of a heart attack or due to cancer, or they were already at the end of life. So these causes of death are getting kind of muddy out there. While the toll of this virus continues to escalate, people struggling with substance abuse, depression, anxiety, and unemployment should not be forgotten. If you're a healthcare professional, if you're in mental health, look around, keep your eyes open, your ears alert. Lots of people are suffering out there, and they might be turning to more drugs, more dangerous drugs, or binge drinking during these tough economic times. I'm Dr. Jim Collins. Thank you for your time.